Hello everyone. The paper we will discuss today is dexamethasone in adults with bacterial meningitis. Mortality and morbidity rates are high among adults with acute bacterial meningitis, especially those with pneumococcal meningitis. Many controlled trials have been performed to determine whether adjuvant corticosteroid therapy is beneficial in children with acute bacterial meningitis. However, there are few data on the use of adjunctive dexamethasone therapy in adults with bacterial meningitis. This study is prospective, randomized, double-blind, clinical trial of adjuvant treatment with dexamethasone, as compared with placebo, in adults with acute bacterial meningitis. Included patients were 17 years of age or older, had suspected meningitis in combination with cloudy CSF, bacteria in CSF, a CSF leukocyte count of more than 1,000 per cubic millimeters. Patients were randomly divided in two groups: 157 to the dexamethasone and 144 to the placebo group. Both groups had same baseline characteristics. One group assigned to receive dexamethasone sodium phosphate at a dose of 10 mg given every 6 hours intravenously for 4 days, and the other group assigned to receive placebo. The study medication was given before the administration of antibiotics. This trial was double-blinded and treatment assignments were concealed from all investigators. The primary outcome measure was the score on the Glasgow Outcome Scale 8 weeks after randomization. The results showed that the percentage of patients with an unfavorable outcome was significantly smaller in the dexamethasone group than in the placebo group, with absolute risk reduction of 10% and p-value 0.03. The results were especially evident in patients with pneumococcal meningitis. Death was significantly less in the dexamethasone group. Using dexamethasone didn't increase the risk of adverse events as gastrointestinal bleeding. In my opinion, the author made a great contribution to the related research field. The paper was cited more than 1,000 times, and the guidelines now include using dexamethasone. The results of our study show that adjunctive dexamethasone therapy improves the outcome in adults with acute bacterial meningitis. Dexamethasone should be given to all such adults before, or with the first dose of antibiotics. This treatment does not increase the risk of gastrointestinal bleeding.